Hello everyone. Today we are going to discuss about some questionnaire that is going to be a rapid questionnaire. So you ready? Everyone ready? It's going to be about the general questions. So I'm going to ask you the questions and we'll expect you to answer. Let's see what questions we can answer. That is okay. We have Shrestha. So I'm Dr. Rohini and okay, so now here we have a little introduction. I'm going to keep it very brief. So I'm going to just tell about myself a little bit. I'm Dr. Rohini. I have about 10 years of teaching experience, teaching both the UG and the PG level. I teach all these courses like the USMLE, the MCI, the PLAB courses. Okay, all these exam aspirants can approach and listen to my classes because I would be covering topics as well as the MCQs and scenario based questions and such things relevant to each one of them. And of course, the NEET PG. Okay, so this is what my specialty is all about. So now we have little more information, that is I have postgraduate degree and UG and PG both from MAHE, that is Manipal Academy of Higher Education. That is, there is a center at both Bangalore and Manipal. Always everyone wants to get a seat in a very prestigious college. So this is one of the universities like that. It is a deemed university and the graduates from there are thoroughly, trained to be an educator. Now you have your educator. I teach anatomy. I also teach micro and physiology courses in the coming months. So right now I'm teaching anatomy. You have YouTube classes. You have special classes. And I have plus classes, which is going to come from next month. This is from the next month onwards. So this is a pure subscription class where you are going to get a lot of benefit by attending or subscribing to these classes, because you will have in-depth curriculum. So curriculum will be in-depth and we'll have a lot of MCQs based things and then scenario based questions, and all the material, that is study material, will be shared with you. All that you can do is joining the plus classes. So you have YouTube classes, which is there every day at 6 p.m. And then I have my special classes at 7:30 p.m. daily. So this is what you can expect every single day. All right, let's move on to the actual topic. You can follow me at, yes, you can follow me at Roaqua, and my code is ROHINI. So you will get a good discount of 10% when you use this code ROHINI. Okay, we have Arpit Patil here. Arpit Patil says hello, and then we have Mona, we have Rishabh, and we have Ashin Shrestha. All these aspirants, NEET aspirants are watching. And let's start with the first one, that is Which one of the following vessels is located just deep to the platysma? Now, which one is located deep to the platysma? Where is platysma first of all? It's in the neck. So we are talking about some of the topics from the neck region. So you try to concentrate on the neck region and try to think from this perspective. Okay. So now here we have which of the following vessels underline the keyword. He is located just deep to the platysma. So we have external jugular vein. Is it external jugular vein? Artery, external carotid artery, common carotid, internal and internal jugular vein. Where is it? Deep to platysma. See, once you reflect the skin, you know that the platysma is attached to the skin. So some of the fibers of platysma muscle is attached to the skin. And then the other insertion is to the base of the mandible. So since it is attached to the base of the mandible and it starts from the skin, you can say that immediately after you reflect the skin, the first thing that you will see is a superficial vessel, right? It is a superficial thing. So it cannot be anything deeper. So it is a superficial, it is not deep. So you think what is superficial? Is internal carotid, common carotid all superficial? No, this is not the answer. So this cannot be the answer. Even this cannot be the answer. All these are deep structures. All these are deep structures. So we want to talk about superficial. So it could be the external jugular vein or internal jugular vein. So right behind the platysma, what do we have? We have A. Pratik Anand says it is A. Let's see the answer. The answer is as soon as you remove the platysma, you will be seeing the jugular vein, that is over the sternocleidomastoid muscle, you can see the jugular vein, that is external jugular vein. So you can see this. It's one of the superficial structure. How is it formed? Anybody? Anybody knows how it is formed? It is formed by two things. One is the posterior branch of retromandibular plus posterior auricular join to form the external jugular vein. So this you remember. So that is the answer. Yes says yes. Pratik says A. Yes. All this is correct. The answer is A. So we'll go back to the question. The answer is A. So this is the right answer. Okay, next one. Okay, how many of you can answer this? Platysma is innervated by which nerve? I'm going to give you a second to think. Now, platysma is what type of a muscle? Is it a skeletal muscle? Is it categorized under muscles of mastication or facial expression? I would believe it is a muscle of facial expression. Right? So it is supplied by which nerve? So muscles of facial expression is supplied by which nerve? Think. Is it facial, accessory, trigeminal, glossopharyngeal, transverse cervical? Facial expression is supplied by facial nerve. So what are the branches of facial nerve? Yes, Ananya says facial, Suvarna says facial, Yash says facial, most of them say facial. Let's see the answer first. So it is supplied by which one? It is supplied by the facial nerve. So it is supplied by facial nerve. All right. So that is the thing. So platysma muscle. So this is platysma muscle and it is supplied by the facial artery and the facial nerve. So this is one. So which one Which branch? It has got so many branches. The branch is the cervical branch of facial nerve supplies because it is in the neck region. So we are talking about neck. So which branch of facial nerve? It will be the cervical branch. Now you have so many branches. We'll go to the different branches of facial nerve. We have first one, you can call this as superficial, temporal. Then you have the zygomatic. Then you have buccal. Then you have mandibular. Then cervical. All these are the branches. So we are talking about the last branch which goes to neck. That is the answer. So the answer is A. Okay. So now all of you have written it is A. Rishabh writes A. Yes, it is A. Next one. Which one of the following ligaments is a thickened part of investing layer of deep cervical fascia? So we are talking about ligaments is a thickened part. So ligament is actually a thickened part of investing layer of deep cervical fascia. Deep cervical fascia has lot of modification. What are the modifications of deep fascia? You have temporal fascia, then you have pretracheal, you have prevertebral, and then you have carotid sheath. All these are modifications. Now here we are not talking about these modifications. We are talking about a ligament. So you think of the ligaments that is present in this. We have stylo and spinomandibular ligament. These are the two ligaments. So now we are talking about stylomandibular ligament. Is this the correct? It is the correct one. Ananya Hande says it is stylomandibular ligament. Some of them are just typing it. And Pratik says A. Is it A? Thyrohyoid. It's a membrane. It's a membrane and it's a muscle. Supraspinous. Supraspinous is not a supraspinous fossa for supraspinatus. Now cricothyroid is again a muscle. And then stylomandibular is a ligament. And ligament amphibium is also a ligament. So now the answer is D. Stylomandibular ligament. So it extends from the styloid process to the angle of the mandible. That is on the inside of the angle of the mandible. So you should remember that it is a second accessory ligament. Okay. It's a specialized, dense, concentrated with deep cervical fascia. And then it is from the styloid process to the ramus of the mandible. So that is the extension of the stylomandibular ligament. The name itself tells you. Next one. Sternocleidomastoid muscle is completely surrounded by. So now sternocleidomastoid muscle is where? It is in the neck. So again here there are muscles that are covered by fascia. That is deep fascia. Deep fascia covers some of the muscles in the neck. Which are those things? Now here we have sternocleidomastoid which is covered, and we have trapezius that is covered. Since sternocleidomastoid is given, it is covered by a collar-like structure which covers around the neck. Collar-like fascia which goes round in the neck. It keeps all the muscles inside. Carotid sheath covers carotid vessels. Pretracheal is in the neck, in front of the trachea. Prevertebral in front of the vertebrae. So this won't come at all. Superficial fascia is fat. So this is also no. So what is the answer? The answer is B, that is investing layer. Many of you say B. Is it B? So it is investing layer. You can see that it covers the neck like a collar. So that green thing, what you can see, it is above, it is attached to the external occipital protuberance. It is attached to mastoid process, and it also is attached to base of the mandible. And below you can see that it is attached to spine of the scapula. You should always know the complete answer. Not just, know that this is the answer, but you don't know the reason. So there should be some reason so that, you can retain your head. So now in front, it is attached to the hyoid bone and it is continuous with the fascia of the opposite side. So it is attached to the hyoid bone as well and it is attached to the fascia of the opposite side. You remember that hyoid bone is also attached to the investing layer. I'll tell you why. I'll tell you why. Because there could be another question, something similar to that. That time you will have to think why we are talking about hyoid bone holding this investing layer. Otherwise, this would have been very lax. It would be very lax. Because it is attached to the hyoid bone, it is held tightly in the neck. Okay, next one. Okay, we have the ligament that suspends the hyoid bone to digastric muscle is. Now, what is the ligament that suspends the hyoid bone to the digastric muscle? So, I just mentioned many things. I told you the investing layer holds the hyoid bone. And then to the hyoid bone, you have a muscle that is called digastric. So now you have digastric muscle. It has got two bellies. You can see this is the digastric muscle. This is the posterior belly. And there is this anterior belly. Okay, it is held by a small pulley-like structure. Can you see this pulley? Yes, some of the classes will be taken in Hindi as well, but this particular class मैं English में लेना चाहती हूँ because my Hindi for all these terminology इतना अच्छा नहीं है इसलिए. So it is better मेरी classes अंग्रेजी में हो. So you can check out if there are any Hindi, pure Hindi classes for all your MCQs. Okay, Golu? All right. You have posterior belly of digastric, then ये anterior belly of digastric है. You can see a small stretch of thing. Now, what is that? It is in front of the trachea. So now there is trachea. It is in front of that. So what do you think this one is? So let's go back to that. Is it carotid sheath? No, carotid sheath. It is not the carotid sheath. Is it superficial fascia? No. What about pretracheal? What about prevertebral? Prevertebral cannot come into the picture at all. So because we are talking about structures in front. So prevertebral won't come. What about thyrohyoid membrane? Does it cover this? Thyrohyoid is from the thyroid extending to the hyoid. But that will not cover the digastric muscle. So what is that? So it is nothing but the pretracheal fascia which forms the loop. Okay, it forms a loop and the posterior belly is attached to the anterior belly, that is here. This is anterior belly, this is posterior belly, and here will be the hyoid bone. So this will be the hyoid bone, and you can see that the lesser cornua and the greater cornua of the hyoid bone you can see. So this is nothing but the pretracheal fascia. I don't think many people would have guessed. So you remember it is pretracheal fascia. Yes, she says it is C, so it is correct. All right. Next, you can see that there is a triangle here. Can you see this triangle? There is a triangle in front. What is this? This is a triangle. And which muscle is dividing this? This is the sternocleidomastoid. It divides it into posterior triangle and anterior triangle. Okay, you can see all these small triangle. Triangle number 1 here. This is 2. This is 3. This is 4. So there are 4 anterior triangles. Okay. Next one. Which one of the following ligaments of neck limits the hyperextension? So how do you do hyperextension? Is it this way or the backwards? So which is the ligament that is in front? So nuchae, ligamentum nuchae is for the, where is ligamentum nuchae? Ligamentum nuchae, ligamentum flava is for the laminae. Ligamentum nuchae is for the spines. And then that is at the back. That is at the back side. So if this is your, vertebral body, and you have this, what is this ligament? What is this ligament? This is anterior, and this would be posterior. And ligamentum nuchae will come to the spine. Ligamentum flava will come to the laminae. Okay. And then there is interspinous, between the spines of all the vertebrae it will cover. But that is at the back again. Intertransverse, that's also at the back. What about anterior longitudinal ligament? Anterior is the one. So actually your face is in front. So when you are extending, you are lifting your head backwards. So that means which one should be? I'll show you the picture. Now tell me, what is the answer? What is the answer? How many of you think it is D? How many of you think it is E? Which one? Hyperextension. So that is hyperextension. So this is also going to sometimes cause fracture. Yes, Pratik says it is E. The answer is E because this is anterior. Front is anterior. This is posterior. Backside is posterior. So which one is stretched? Stretched. So which one is stretched? Anterior. Yes, it is. Hangman's fracture. Okay. Hyperextension, that is also whiplash fracture. That is followed by flexion and also hyperextension. You're right. So the answer is, go back to that. The answer is E. Okay, that is anterior longitudinal ligament. So Arun Sharma also says it is anterior longitudinal. Okay, next one. Okay, let's see what is the layer that overlies the phrenic nerve. What is the layer that overlies the phrenic nerve? So which layer overlies the phrenic nerve? So now there is where is phrenic nerve first of all? It is coming from the cervical plexus. It is coming from the cervical plexus. What do they supply? It supplies the pleura. It supplies the pericardium. It supplies the pleura and the pericardium. And it also supplies the diaphragm. So when it supplies the pericardium, that is fibrous. It is loaded with fat. Correct? It is loaded with fat. So what do you think is the answer? Now tell me, what do you think is the answer? Platysma, superficial fascia, pretracheal fascia, prevertebral, and investing layer. So you can always debate between two things. One is the superficial fascia and the pretracheal fascia. How many of you say it is C? I get one answer where investing layer of deep cervical fascia. No, this is only in the neck. Tanzil? No. So that is not E. So E, it is not E. It is not E. It's not. Next, Yash says it is C. Many of you say C. Varun says C. Why do you think? Because this extends up to the superior mediastinum. Right? It extends up to the superior mediastinum. From where? From the hyoid bone. From hyoid bone to superior mediastinum. So it has lot of, stretch. It can go up to the superior mediastinum, and the phrenic nerve lies close to the pretracheal fascia. So that is one thing. But it's also true that in this region, the superficial fascia, which is loaded with fat, is also present. Okay, next one. So this is how you can identify the phrenic nerve. You can see this is the phrenic nerve. You can see the branches going to the pericardium, pericardial branch. You can see the branches going to the diaphragm. You can see the branches going to the lungs. You can see all these are the branches that supply the pleura, pericardium, and the diaphragm. So now you can see there is this, it is present in the superior mediastinum. You know that this superior mediastinum and inferior mediastinum. So now it lies in the superior mediastinum. So this is the superior mediastinum. So how do you divide the superior and inferior mediastinum? You have the superior and inferior mediastinum separated by this, the sternal angle. This is the sternal angle. This is at the level of second rib. You can see the sternal angle. You have this manubrium part. And then you have body of the sternum. This is the sternal angle. Above this is superior. Below this is inferior. What level is this? This is at roughly at the level of T3, T4. That is the level. T3, T4 level. Okay. So the answer here is C. Okay, Varun says T3, T4, you're right. Next, first in the space. What space of the neck passes as downward as superior mediastinum? Now, what space is there? Okay, now in front of the neck, you have what are the structures that you can see in the neck? Superior mediastinum is behind. In front of superior mediastinum, what is there? In front of this, what is there? In front of this, what is there? Think, what is there? Is it something to do with submental? Is it submental? Is it prevertebral, submandibular space, parapharyngeal, retropharyngeal? Which one? Is there something called submental space? I have heard of lymph nodes. I have heard of triangle, but not submental space. Okay, it's a triangle, submental triangle. Then we have prevertebral region. It's a prevertebral region. It's not a space. Then submandibular region. Then you have parapharyngeal space. Correct. This is a space. So which are the things that we are going to eliminate? 1, 2, 3. Why we eliminated? Because this is a triangle. This is a region. This is a region. That's why we eliminated. We don't want that. So what is there? We have parapharyngeal space. We have retropharyngeal. Which one? Tanzil says it is retropharyngeal. How many of you say parapharyngeal? Let's see what is the answer. So now you can see that the pharynx is right behind this region. You have the esophagus, and then there is this Trachea, you can see right behind that will be the esophagus. On either side is the parapharyngeal space. And the answer here is the pus in the space of the neck passes as down as superior mediastinum. The answer here is E, that is retropharyngeal. So now here the answer is behind the pharynx, it is retropharyngeal. All right. So that is the answer. Yes. Most of you got the answer as E. So you can get always confused between para and retro. It is not para. It is not on the sides. It is behind the pharynx. So that is the space that occupied by superior mediastinum. Okay, next one. See, this is where the division is. This is at the level of the sternal angle. What is the other name for sternal angle? Anybody knows? Pratik says hi and you're happy with it. So please go ahead and like the video that we put up. You can like the video, you can subscribe, and you can always use the code, this code ROHINI, to access all the videos and also get 10% discount on your subscription. Okay. It is also called angle of Lewis. You're right. All of you are right. Okay, next one. Moving the head so that the face looks upwards and to the left is a movement produced by which one? So you are moving the head in such a way that face looks upwards and to the left. Upwards and left. Think now which muscle is contracting when you are lifting your head upwards and left? Who thinks? What is the action of platysma? Something on the neck, right? So it has got nothing to do with the moving the head. What about trapezius? Shrugging of shoulders. What about geniohyoid? Geniohyoid. So that is elevation of the tongue. Sorry, that is depression of the tongue. What is right sternocleidomastoid function? What is posterior belly of digastric? Posterior belly of digastric is again part of the digastric triangle. Okay. What is sternocleidomastoid action? See, when the right side contracts, you will turn your head to opposite side. So the opposite side is nothing but left side. So that is what happens. You are turning your head to the opposite side, that is left side. So you are turning to the left here. That means it is the action of right sternocleidomastoid. How many of you mentioned that is? Okay, so now here there was a small confusion. Somebody wrote it is protrusion of the tongue, Mona. That is genioglossus. Okay, that is genioglossus action is depression and protrusion. Okay, depression and protrusion. So that is the action. So this geniohyoid does a small contribution to depression. That's it. So that is the small, muscle from the genial tubercles. So you have two tubercles on the mandible. This is the mandible. So you have two tubercles. There is like this, four of them like this. This is for genioglossus. This is for geniohyoid. So geniohyoid muscle. So what does that do? That will try to pull the tongue downwards. That is in depression. Okay. Next one. So this is sternocleidomastoid. You can see the attachment of sternocleidomastoid. You can see the origin. It has two heads, mandibular head and the clavicular head. So between these two, you can look for the which artery? Which artery between the two heads of sternocleidomastoid? Anybody knows? Anybody knows which artery lies between these two? Which artery lies between the two heads of sternocleidomastoid? Yes, yes says carotid, yes. So when you give the carotid artery, so we use this for embalming. And also for checking the pulse. It is not superior thyroid, it is the, I'm talking about not in the region, I'm talking about between the two heads, which one? So it is between the two heads, it is the carotid artery. Okay, next one. The neck is divided into anterior and posterior triangles using which muscle as the landmark? We have a big landmark, in the neck that is formed by this muscle. What is this muscle? This is in front of this is anterior triangle. Behind is posterior triangle. What is this muscle? The answer here is the sternocleidomastoid. Okay, so this divides the neck region into anterior and posterior triangles. One thing, can someone tell something special about trapezius muscle? So what is the nerve supply of trapezius muscle? Does anyone know what is the nerve supply of trapezius? It is the spinal accessory. Okay, this spinal accessory supplies only two muscles. One is trapezius, another one is sternocleidomastoid. So why it supplies trapezius even though it is in the shoulder region and almost in the supraclavicular region? So this is in the supraclavicular region. So it should be supplied by which nerve actually? It should be supplied by brachial plexus. But it does not supplied by base brachial plexus. So there is a exception. Very, very important. If there is an exception, trapezius is supplied by spinal accessory. No, it was supposed to be supplied by brachial plexus actually. Okay, next one. Anterior belly of digastric is supplied by which one? Anybody? Anyone knows it is supplied by which nerve? Anybody? This is a very tricky question, I know, but let's see if anyone knows what is the answer for this. Anterior belly of digastric is supplied by which nerve? There is anterior and posterior belly of digastric. But anterior is supplied by the nerve 2? No, it is supplied by not facial. It is supplied by nerve 2 This is a derivative of the first arch. The posterior belly is derived from second arch. So it is supplied by the facial. You're close, but you messed up the arches. So it is purely because of the development. First arch derivative is the anterior belly. The second arch derivative is posterior belly. Okay, so this is one more question which is very, very important. Okay, next one. Yes, Akash Bhatt. Yes, you're right. No, Akshit Bhatt. Akshit Bhatt says it is nerve to mylohyoid. You are so right. Okay, the triangle of the neck that lies between anterior and posterior belly of digastric. Which triangle lies? So first of all, it's a part of which triangle? You have anterior triangle, and that is again divided into so many triangles. So in that category, there is this anterior and posterior bellies of digastric. So the name itself gives you a hint. What is this? 39th question, he says submental. But is it bound by both anterior and posterior? No. If this is your neck, if this is your mandible, okay, this is your mandible. What is this? This is your sternocleidomastoid. This is your sternocleidomastoid muscle. Now, what is this triangle called? What is this triangle? This is the first thing. Here will be your hyoid bone. What is this triangle? Now, this is the submental. What is this called? This is called submandibular. What is this called? This is called the carotid. This is called muscular. This is carotid, muscular. This is the submandibular and this is submental. It is bound by the posterior belly of digastric. If this is your neck, then you have your this one, mastoid process. You have your posterior belly of digastric and anterior belly of digastric. This is anterior belly. This is your posterior belly. This is anterior, this is posterior, this is mastoid process. So what is this triangle? Submandibular triangle, or it is also called submandibular triangle or digastric triangle. So the answer is E. Okay. Mona writes submandibular. Yesh says it is E, and Pratik says anterior triangle. You're right. Okay, we'll go to the next question. That is, the posterior triangle is divided into two triangles by which muscle? Now, there is this anterior triangle and posterior triangle, right? We have this neck, and then we have this mastoid process. Okay. Now you have sternum. This is the clavicle. Which is this muscle? Sternocleidomastoid muscle. Now you have the posterior triangle. This is the posterior triangle. It is divided into, now you have this posterior triangle that is divided into two. There is a small muscle called omohyoid that divides this into two. So there is a muscle by name omohyoid. So there is a loop that is superior and inferior. So digastric, no. Trapezius is at the back side. Mylohyoid is in which triangle? Anybody knows mylohyoid is in which triangle? It is here. It is below the anterior belly. So this is in the submental triangle. Sternohyoid is in the neck. It's a strap muscle. Infrahyoid muscle. The infrahyoid muscle. What about omohyoid? So that answer is omohyoid muscle. How many of you said it is C? You say C, Pooja says C, and Yash says C. So the answer is omohyoid. Okay, next one. Stab wound directed into submandibular triangle may lead to. So what is present in submandibular triangle? What can happen? Which nerve do you think is present in the submandibular triangle? How many of you can understand the question? Stab wound directed into submandibular triangle. What is present in submandibular triangle? Submandibular gland. Submandibular gland has a superficial and a deep part. Right? Superficial and a deep part. So which nerve is related to this? So some nerve is related to this. What is this nerve? Anybody? Who can answer this question? Which nerve is related to submandibular gland? I'll give you a second. How many of you can quickly think? Is it ptosis of the eye? Anything to do with the ptosis of the eye? No. That is Horner's syndrome. So that is not the thing. Then it is drop of the shoulder. Is it true? Is it drop of the shoulder? Is it deviation of the tongue? Deviation of the mouth? That has got something to do with the facial now, right? So that is not the thing. That is not the answer. Drop of the shoulder, that is trapezius. So that is not the answer. Then what is the answer? Tilting of the head to the same side, that is because of sternocleidomastoid. So which one is the answer? Which one do you think is the answer? How many of you say it is the Pooja says facial? Why everyone thinks it is facial? Facial nerve is not in submandibular triangle. It is in the parotid. All of you take back your answers. It is not correct. Facial nerve has got something to do with the parotid. It has got nothing to do with the submandibular. So not submandibular. It is the lingual, and yes, somebody is talking now correctly. It is D. Who said D are correct? Pratik said D. Dandeep Kaur said D, and Sam already said D. Yes, Sam is the first one who said D. So it is deviation of the tongue. So deviation of the tongue, that is because of paralysis of which nerve? Hypoglossal nerve. That is the 12th cranial nerve. So 12th cranial nerve lies within the submandibular triangle. So that is what we are supposed to talk about. Lingual nerve hooks or loops around the hypoglossal Okay, it is not lingual. Lingual goes into the tongue. Goes directly to the tongue. Submandibular is below the tongue. Okay, so it is not lingual. Here we don't have lingual, and it is because of the hypoglossal nerve. Lingual is actually got nothing to do with the muscles. Lingual is for the sensory, right? So deviation of tongue, why it will happen? Deviation of tongue will happen because of paralysis of the muscles. Correct. Muscles are supplied by hypoglossal, not lingual. Lingual is sensory to tell you hot and cold. For anterior two-thirds of tongue. That is its action. Yes, Palak says it is to tell the temperature, hot or cold. So if you have eaten a hot food or a cold food, how do you know? By lingual nerve, which carries which fibers? Anybody knows which fibers it carries? It carries general sensory. General sensory fibers it carries. So this is what you're supposed to remember. Okay. Yes, you're right. Sam is correct. General sensory. He says GSA, it is afferent. You can call it as general sensory afferent. Next one. What is the answer for this? Last question. This is the last question. What is the thing? Roots of cervical plexus pass anterior to which muscle? Roots of cervical plexus pass anterior to which muscle? So there is this cervical plexus. It passes anterior to which muscle? Anyone? Randeep, scalenus, medius, anterior, posterior, semispinalis, sternocleidomastoid. Anybody knows? Scalenus, anterior, medius. Which one is related to medius? The brachial plexus. Anterior to this will be scalenus, anterior. So you see the difference. Medius, brachial plexus, anterior. The answer is cervical plexus pass anterior to scalenus anterior muscle. Okay. What is one of the important, which nerve is derived from scalenus anterior? Which important nerve? We were talking about this all the time. Which nerve is derived? Anybody knows? Phrenic. Phrenic comes from cervical plexus with the root value. What is the root value of phrenic? What is the root value? Yes, Mona, it is phrenic. What is the root value? C2, C3, C4. This is the root value of phrenic. Okay. So with this, we come to the end of the session. So please subscribe. This is one thing I want to tell you in all my classes so that you can get more videos to watch on YT. You can see YouTube every day at 6 p.m. You have a class from me. every day at 7:30. You have the special class. So you need an app called Learners app, so which you all have. So you have been watching the videos. Please pass this message to your friends so that they can also get interactive with the classes, and we'll have more people to answer the questions and it will be more fun. And then whenever you always discuss the answer, it becomes easy to retain. Then I have another class at 9:30, which is this class again on YouTube. So please watch this special class with the Learners app. I ask all of you to please download the Learners app to watch the 7:30 special class. In the future, I'll be doing more of the plus classes. You can subscribe and we'll do a lot of MCQs. We'll do a lot of clinical based questions, scenario based questions, and it will be very interactive. Okay, and everything comes with the concept, and then everything is justified. All the answers are justified so that you can remember the things really well. Okay, so that is the end of this class, and thanks for watching. Good night to everyone.